am Dr. Sandeep Mahapatra, consultant hair transplant surgeon at New Follicle Hair Transplant Clinic, Bangalore. Today we have planned a hair transplant operation for Abhishek, who has come from Delhi. He is 28-year-old, almost having a grade 5 male pattern hair loss. We have prepared him for the hair transplant, NFT hair transplant, which is advanced FUE technique, and he has been done all the pre-operative investigations and pre-operative instructions he has followed meticulously, with a morning head wash to having the pre-operative antibiotic medications, antacids and relaxation medicine. Now we are all set to go for the extraction. Before that, I would like to design the hairline for Abhishek. So as you see, he has a big area of hair loss, where we will address in 2 sessions subsequently. So first session, I will design his hairline frontoparietal frontal area from zone A to zone B with a hairline correction. So I will position this at the mid-glabellar position of around 8 cm, and we will try to make a hairline which would look very natural and normal to his age and his facial symmetry. So a U-shaped hairline should be good, with some irregularities in the frontal hairline. And he has a well-defined temples as well. So first session we are planning close to 3,500 grafts for him, which we will be placing majorly in this frontal and top area, and we will be extending little towards the crown area, giving a very good density at the frontal tuft, where we will plan approximately around 2,500 grafts in the frontal tuft, and subsequently around 1,000 grafts at the zone B. This is how we are going to plan the hairline design for him. Abhishek, just look at the mirror and tell me if you are okay with this kind of hairline which we have planned for you. I think it looks good to his face because he has a broader forehead, so an oval shaped hairline should look good. And 3,500 grafts, which will be corresponding to at least 7,500 follicles, should give him a good coverage, and his donor looks pretty good, straight, smooth hairs, with a density of close to 45 to 50 grafts per centimeter square is what we are planning for him. Okay, so now we'll start the extraction. We have completed Abhishek's hair transplant procedure, the advanced FUE technique of around 3,500 grafts yesterday, and today he has come for the dressing removal. As you can see, we have removed the dressing from the back, and the healing is quite good, and the implanted sites have also started healing well. These caps will start falling after 1 week once he starts shampooing his hair after a week. For 5 days, medications we have given him antibiotics, antacids and some anti-inflammatory medications, and after 1 week the shampoo will start. Regularly he can continue for 1 or 2 months with the mild shampoo. After 2 weeks, I have put him on minoxidil and other vitamins for enriching the hair growth. So how do you feel? Was there any pain or?
There was not much pain. There was just brief pinching at the beginning when the anesthesia was being delivered, and after that there was no pain. It was a completely more or less painless procedure.
Okay, and how do you feel about the overall hairline and the
hairline is pretty good. It looks very natural.
And the density?
The density as of now also I'm okay with it, and now once it grows it is supposed to become much more thicker and denser.
Yes, once it grows it will become more thicker, denser. Probably around 6 to 8 months time frame he should see good results of the front and top area where we have implanted, and after 3 months we are posting him for the crown area vertex restoration. Oh, thank you.
Thank you.
Abhishek, we had done his first session of hair transplant exactly a month back on the front and top area of his scalp. So I will closely show his results in the frontal aspect, where the hairs are aligned properly, giving a natural appearance in just a month time. Some hairs have gone into a shedding phase, which is quite common post any kind of hair transplant, but majorly other hairs are still growing. This session we are planning the crown area restoration for him, which is a oval shape. In a proper crown restoration fashion, in a radial way, we have to arrange the hairs so that it grows in a very natural way. So crown area restoration of hair transplant is a different ball game, and it has to be done properly. And if you have seen, just turn around my shape. This donor area is almost healed up. So this time we will be extracting majorly from the sides above his ear, this area, which and below this nape of neck area where the donor is still healthy, so that we can roughly extract around 2000 to 2300 400 grafts, which will correspond to at least 5000 follicles to give him a good density and little bit correction of the hairline. So are you okay, ready for the procedure, Abhishek? Okay, we'll go ahead with the trimming, then local anesthesia, and then this advanced FUE technique of hair transplant.